Hello, my name is Tamara McQuistion, and I'm one of the founding members of SNPT. We are a nonprofit organization located right here in Coos County. I'm also the executive director of SNPT's low-cost spay and neuter clinic. I'm going to take you guys on inside, and we're going to go take a tour and see what we do here. This is our front lobby area. All of our dogs and cats that come to visit us will enter this area right here and speak with Mickey at our front desk. She's our office manager. Everybody's going to fill out paperwork, give us authorization to examine your pet. All pets have exams here, as well as to be able to perform surgeries on your animals. And then you're going to see me, and I'm going to ask you some preoperative questions that are very important to make sure that your pet is healthy and that surgery is going to be safe for them today. This is where the dogs await their surgery. When they're in here, they're waiting also for the doctor to do their exams. First thing in the morning, the dogs will come in here, and then they'll be paraded through in an orderly fashion to go and see our veterinarian. They're looked at, their eyes, their ears, their nose, their mouth, their heart, to make sure that they're in good physical condition and will be able to be spayed or neutered today. Then we're going to mark their cage card with their names. They're going to receive an ID collar so that we'll always know who it is, and there'll never be a mix-up here. And then we'll also know what services that you're needing here today. SNPT not only does spays and neuters, but for those animals who are visiting our clinic on the day of their surgery, they can opt for a few ancillary services such as rabies vaccine, distemper vaccine, flea treatments, ear mite treatments, things like that that you may need. And then after they're done here and they're ready to go onto their spays and neuters, they're going to be heading into our preoperative area. This is our cat kennel area. This is where your cat's going to wait before its exam, after its exam, before its surgery, and after its recovery process. I didn't point out the chair while we were in the dog kennel room, but I wanted to point this out while we were in the cat kennel room and bring attention. This chair is where one of our volunteers sits in the afternoons after the cats have come off the recovery bed. She just serves the purpose of another set of eyes to watch these animals as they're finishing up their recovery process prior to going home to you. The dog kenneling area is the same way. We have a person who sits in there with them to make sure that the recovery process is going smooth and successful, just like it did on the recovery bed. Once the dogs start to move around or the cats start to move around, it's no longer safe to keep them on the bed, so we go ahead and take them back to their cages where we can watch them a lot safer. This is our recovery bed. This is one of the most important spaces here in our clinic for post-op. This is where we monitor all of the animals right here on this bed. This is a heated bed. There's a heated blanket underneath of here that helps to keep the bed warm. When the patients arrive at this bed, there's a few things that we do to minimize any kind of complications that could happen post-operatively. Your pets haven't had food and water since 9 o'clock the night prior to this surgery. So here at SNPT, to make sure that their blood sugar levels stay stable, we give all of the pets that come through here, whether we believe they need it or not, all of the pets receive sugar lips. And what this is Caro syrup, and we apply it with a cotton tip applicator. And then we rub it around your pet's gums. One of the other things that we worry about postoperatively, and this is something that we do see more of than we do hypoglycemia, is hypothermia, and that's when the pet's temperature begins to decline due to anesthesia. So that's the reason why it's really important that these animals are on this heated bed. Not only do we put them on a heated bed, but we also use these rice bags. So the animals are on their own separate, or wrapped in their own separate blankets, so they're not on a community space other than this bed. And then they have these warmed rice bags that are laid around them to try and keep their heat in. Something else that happens here is we're able to monitor these pets to make sure that their heart rate is adequate, their respirations are normal, and we're able to pull the tube at an appropriate time. And this dog is almost to that ready stage. He's starting to kind of swallow a little bit, so we'll be pulling the intubation tube here in just a couple of minutes. This Akita is on a stretcher. And the reason why is because she's 96 pounds, so she's a very large dog for us at this clinic. It requires many people to be able to lift her up to get her into surgery and many people to get her back to her kennel when it's time. She's actually waking up. This is Darcy. She's one of our volunteers here. She's been with us since the beginning of this clinic from day one, and she's been trained in all of the emergency recognition procedures and things. And how we continue to monitor progress is we will touch their eyes and make sure that they're breathing as well, and we also will check their capillary refill time. We want to make sure their gums are looking good, that they've got good color. This is what we do. We push on it and then we see how quickly it fills back in. When pets come to the clinic, and only those pets that come to this clinic for spay and neuter, they can opt to receive some additional services if they'd like. Some of the services that we offer here at this clinic are rabies vaccine, distemper parvo for dogs, and distemper for cats as well. We call it the FERC-PC vaccine for cats and DHLPP vaccine for dogs. We do nail trims here. We can also test for FIV, FELV in cats. We can do heartworm tests on dogs. And we do flea, ear mite, and worming treatments for both dogs and cats. This is Rocco Jess. He's here today to receive a neuter. And I also see that he has what I believe to be a rabies vaccine as well in his baggie. So he has opted for at least one of our additional services here. Right now he's undergoing the induction process. And he's pretty out of it right this second. It only takes just moments for the Telazol to start to work. All of the animals here at the clinic are intubated, except for our male cats. Who you see working today right here with Rocco Jeffs is Betsy. She's one of our surgical assistants, and our CVT, which is a certified vet tech, Jessica. This is our surgery suite. This is our doctor. His name's Dr. Daniel O'Berry. He's been a practicing veterinarian for 22 years. What's going on in this room is obviously the animal is receiving its surgery right now. This is where all the magic happens. Heather is our surgical assistant in the surgery suite. Again, all of the patients in this area are monitored for oxygen saturation level as well as heart rate. Now we're back to the lobby area. This means that your pet is fully recovered and is ready to go home with you. And I'm going to give you the best instructions possible for a successful postoperative experience when you get home with your animal. And this is our transport van. We make trips monthly to Curry County, Douglas County, Lane County, wherever communities may need us to come and pick up animals. A lot of people in these areas live in depressed areas where there's no transportation to our clinic here. So SNPT has developed a transport program to go and pick up these animals the day prior to surgery. We bring them here to this clinic, we spay and neuter them, and then we take them back. And we meet at a general location that's easy for most people to get to. And if we really truly needed to, we would certainly go to those people's houses because the pets need to be spayed and neutered. This is what's going to help us reduce our euthanasia rates here in our area shelters. I want to thank you for coming and visiting the SNP clinic. Again, my name is Tamara. I'm one of the founding members of SNPT, and I'm also the executive director here at this clinic. Come and visit us anytime. Thanks.